If I was the clinician, would I use this product? If I was the patient, would I use this product? And if the answer is no, there's no point moving forward from this. Even if you're not a clinician by background, even if you're a tech, you know at the end of the day what the user lifecycle looks like. If you're a builder of it, you're a founder, you need to ensure that either you talk to enough end users and understand how well are you solving their problem, or you're adding more burden to it. Just a small thing like which you feel may not be that important, but the end user experience actually changes significantly with you not doing or doing that specifically.
Welcome, MedTech Gurus. Today we're delighted to be joined by Dr. Ashok Gupta, founder and creator of TheraNow, an 8-figure virtual physical therapy platform that has served more than 70,000 patients across the United States since 2021. Ashok didn't start in Silicon Valley. He started as a practicing physical therapist treating veterans in VA hospitals, traveling across rural America, working in ICUs, home health, and small town clinics. And everywhere he went, he saw the same systematic challenge: access. In many communities, care was simply too far away. When virtual mental health therapy became mainstream, Ashok asked a bold question: why not physical therapy? Despite skepticism and the obvious irony of the word physical, he believed most PT could be delivered virtually with the right design and support. Today, TheraNow works with major health systems like Providence and operates a network of more than 400 virtual therapists, while also building AI-powered documentation tools that clinicians actually use. Ashok brings a rare combination of frontline clinical experience, operating level scaling, and real-world digital execution. Hey, Ashok, are you ready to be our guru today?
Most welcome. Thank you, Tom, first of all, for having me over here. And I'm looking forward to our conversation.
Yeah, we're excited to have you. So tell us something fun or interesting about yourself or your family so we can get to know you a little better.
Oh, sure. I'm a father of 2 girls, 4 and a 5. And the amazing thing is my co-founder is my wife also. And so it's always, our dinner conversations are not usual dinner conversations. Is half tech, half business, and half kids. So it is a different mix to grow up in a family like ours.
Yeah, it sounds like a very busy household, to be sure. What are the kids into?
They're just 4-year and 5-year-old, so they're following us through. They're part of our every single deal, any conversation related to business and work. But if not that, then they're doing piano, swimming. These days, kids have a lot. We grew up in a different time for sure.
Yeah, that's for sure. So I'd like to start off with, as we mentioned in the introduction, you saw firsthand that access was the core problem. And I'd like to, at that moment, you realized that virtual physical therapy wasn't just possible, it was necessary. Tell us about that moment that you realized that.
Right. Yeah, working across rural America, I kept seeing the same issue over and over again. Patients were driving like 2 hours for 30-minute session, mainly because they didn't have access to a good facility nearby. Simply stopped going, many of them. Like towards the end of it, as soon as they get a little bit better and they think like, oh, I can get by. Now, that was not the best of the decision for a majority of the patient population, because after some time, the whole problem reoccur, and then they have to go through the entire program. So that's when we saw telemental health or psychiatry growing up pretty quickly in the 2015, 2016 timeframe. So we started to think about, how can we not do movement therapy also if the mental health and mental therapy can be done virtually? So that was the seed. And today we are running a successful company around telehealth physical therapy.
That's awesome, right? And just trying to build that. But as I did my research, it looked like there were some virtual physical therapy programs that struggled before and after the pandemic. So why do you think most of those virtual physical therapy platforms weren't successful?
No, you're right about your research. They think telehealth is just a video call instead of a workflow problem. That's the major difference between a telehealth solution versus a telehealth considered as a video call. They're trying to bypass the health systems and offer video services to the patients directly. They underestimate the therapist adoption as one of the key role in being able to provide a telehealth physical therapy. So when we built TheraNow, we kept the therapist at the core of the services. We partnered with health systems and we offered the services as if like patients were receiving a care in the hospital system itself. But the difference is like you don't have to travel.
Oh, yeah, that makes total sense. And I like that you mentioned workflow, right? Because so often we see some of these solutions and, the therapist or the provider has to go through a lot of extra steps. But it sounds like you just kind of incorporated that basically into their everyday practice. Am I heading down the right path with that?
That was the key for success, I would say, because we didn't start as a pure tech company and then building a technology and then trying to have somebody adopt it. Me, myself, being a doctor of physical therapy, my wife being a doctor of physical therapy, we worked in all these atmospheres before. We worked in a VA health system and in the small and rural hospitals and a large hospital systems. So we knew the workflow of a day-to-day physical therapist. And now we built the technology around it. So when we offered these services to the health systems and all our clients, it wasn't an extra work or like a very different workflow than what they were already doing. So I want to say when it comes to healthcare specifically, integration is one of the key piece. And a lot of time the word integration is taken very differently. They think like it's a software integration of taking one software and connecting with the other. But I always talk about integration as a holistic approach.
Hmm.
You take integration, you integrate the product into the workflows, not only like into the EHR to EMR or like a one ERP to another software, but in your day to day. So if the patient walks into the clinic, from that point on to the end of the patient journey, if your product doesn't fit right into the same journey, and then even if they want the product to have the patient move into a different direction for even a small step, you will start seeing your adoption will go down significantly.
Yeah, that's a really good point. And I was also curious, many of our gurus out there listening in are entrepreneurs or soon to be entrepreneurs. And, you've scaled to 400 plus therapists and 70,000 patients, which is no small feat, right? Congratulations on that. But what were some of those key operational decisions that allowed TheraNow to grow to that kind of size of an organization? Do you have any insights for us there?
The best way I can say is we treated this entire company as an operations first.
Hmm.
So we built the product, a technology around our operations efficiency. So you take like an old school hospital system or a physical therapy practice, and then you take it and then you try to scale it. After some time, you'll start seeing the cracks open up because you can't really take that level of volume. And the way we analyzed our exact product was we have three main pillars. We have a patient, we have a therapist, and we have a health system who's actually helping us connect our therapist with the patient. And then we built these entire operational workflows and a technology that actually helps all three of our stakeholders properly. So that was the way. And I wouldn't want to say we knew everything from the day one. We learned it along the way. We just this week, perfect timing though, we just this week released our new product feature, which is integrated ATS, applicant tracking system. Our average onboarding time for a physical therapist was 14 days. From job posting to job application and all the way through onboarding and seeing the first patient, which is incredible compared to the rest of the industry. 14 days was amazing. But we still felt like that is one of the friction point. And then with our newer fully integrated asynchronous onboarding and hiring platform that we have added into, our average time has gone down to 3 days.
Wow, that's remarkable.
If you don't have demand and supply, if you have too many patients and you don't have enough clinicians, which in America today, we are facing a big shortage of especially some specific healthcare workers, and physical therapists being among one of them. So if you don't make your platform efficient enough, you're going to start actually like hitting the ceiling.
Yeah. So we touched on, the other type of integration, but you kind of lead into the Epic integration, right? Where many startups claim they have Epic integration, but the real HL7 FHIR execution is a different story. So what's the integration gap that most health tech founders underestimate?
Question here is, are you trying to claim that you integrate with the software?
Mhm.
Or you're actually trying to build a product that integrates into the workflow? And if the answer is the later part, then definitely the right way to do is like first you have to take end-to-end workflow
Mhm.
and have a solution, because a hospital system is not going to get rid of their existing EMR or EHR for your software, your solution. If your company or your product is based on the software, it must be able to read and write out of the existing EMR and EHR. And then now there is like, if you just have one piece or one section of your workflow connected, you can claim, yes, you are integrated, but that's not going to really solve the problem. So I'll give you an example of TheraNow. So when we started building TheraNow, if you look at the medical practice, it's all about patient onboarding, referrals management, then being able to do outreach, then providing the care to the patient, documenting for the care, then being able to bill for the care. Now, there are so many journey milestones we have on the patient. It sounds so easy to say, like, you're providing physical therapy or you're providing healthcare, any type of service. But when you start looking at this entire journey, there are so many steps in it. And then that means any software you look at will also have to have these different modules. And then if only one of the modules connects, then the other pieces are going to fall apart. I'll give you an example of like a lot of time, many newer applications are leaning only on Fire, FHIR, which is a great engine to connect via the APIs. Now, very low lift API integration, but also have a limited use cases available out there.
Mhm.
You won't be able to create a very sophisticated integration or like an entire workflow. So for example, in TheraNow, what we started to do is like leverage all multiple different technologies like HL7, Fire, and then custom APIs. And we built from referral management all the way to the billing, each and every single interface. And then not only you have to build the integration, you have to build a security protocols around it too. So the more technology you develop, then more responsibility comes on your shoulders to make sure that it's secure and it's reliable.
Mhm. Yeah, that's really interesting. It kind of leads into my next question too, because you've built AI-powered clinical documentation tools that are actually adopted by therapists, as you were talking about. So, how did you differentiate this to avoid some of the workflow traps that kill so many healthcare innovators? Can you dive in a little deeper for us there?
Sure, definitely. I think I'll extend on to what I was just talking about related to workflow integration, right? So this also comes into play. There are two parts to the success of any AI documentation tool. One is like how well integrated it is, and then second is how well it works. And I usually say how well it works is second, because you can take a little bit of like less quality output because you can go in and edit and make a tweak to the answer. But then if you have to log on to a separate portal, then you have to actually feed in all this contextual information. And then you actually get this information and you have to edit there and then copy and paste into this. That itself is already like a failure point. So that's why that's more important for me, my personally. And then for the adoption level, we have also seen that is very significant. And then the second is like a product itself, like how well your note is customizable. Is it built for a specific use case or purpose or not? And if you could want to deep a little bit dive into deeper into how the AI models work into the AI documentation, there is also a little bit of a scope to actually talk about how majority of the AI documentation tools are built around a PCP in a 10 by 10 room, talking to a patient in a very quiet atmosphere about a very specific general physician practice. Most tools are built around that ideology and then extended into the other specialties. When it comes to ancillary services like nursing or physical therapy, and I'm going to specifically focus on physical therapy here, you're in a gym. You have Ashok treating John and Tom treating Smith, and then you have another person over there, and then you're not confined to one specific private area. You're running around the whole place, or you are on rounds on the hospital. You're in ICU. You're from bay to bay, moving around. Those tools are not sophisticated enough to move along with this different workflow. So it needs to adapt to these different kind of workflows. Now that is one. And then the second one is like, what kind of data or is it built on? So, for example, we have been providing physical therapy and occupational therapy and speech therapy services for years now. We know what works and what doesn't, what kind of conversations happen between patient and the therapist versus a doctor of, let's say, physician itself. Like a physician will have a very different discussion with a patient versus a physical therapist having a discussion with a patient. Now, these two models fed with a totally different data set are going to produce a totally different outcomes when it comes to it. So that's where the big difference is. Like, and that's where we're seeing a success of our tool being adopted very well, is because it's built for a specific purpose, built from a specific data set, and built for a specific workflow, not having to. So we built a custom native built into TheraNow itself. So you don't have to like hop around to different portals and things like that.
Yeah, that really is helpful, right? Because I didn't think of it in the way that you're moving around in a very dynamic environment with a lot of different types of equipment, perhaps. And I would think also different ways of evaluating, right? I mean, you might have some specific measurements, but it's also somewhat an art form too from a physical therapist to go, well, hey, Tom is responding a little better, looking at both the measurement of maybe, the way my leg moves versus, what's the pain level, right? Am I heading down the right track? I mean, there's a lot of different variables happening there, right?
Oh, no, absolutely. You're touching a very valid point. Like a lot of AI documentation tools are leaning into CDI, clinical documentation evaluation, and then also like getting into RCM as well, revenue cycle management. And then as we start actually talking, I'll give you a smallest example. If I am treating you for your low back pain, and I offer you an exercise protocol which requires you to do a squat movement, like sitting down on a chair and getting back up. And now I need to bill for this service. Me as a clinician, I know I just made you do lower leg stretchings, your back stretchings, and isometric exercises. I spent X amount of time on those activities. My intentions were to actually do a neuromuscular re-education of your core muscles, not doing a squat for your lower body strengthening, but for the core re-education. So because my purpose was different, it is actually a totally different code, 97112, versus a normal tool or AI. If the moment you're going to ask like a Google, like a squat would be of what best type of billing would go for, it will say it's a therapeutic exercise, it's a 97110. Me as a clinician, over the years of experience, I understand this context. And then that's how I bill for my services. But does your AI model understands these nuances and then be able to actually take like, okay, because I haven't done enough in therapeutic exercise, and my intent was XYZ. And in front of the patient, have you ever been in therapy and then actually heard a therapist, I'm going to do a squat so that you can do XYZ and so I can bill for Y and Z? That's never going to happen. That's not going to be spoken out loud. And that's where most of the AI models actually start failing.
Yeah, that's really fascinating. And because as I did my research, it looked like your documentation accuracy improved like 20% in your model, if I've got that right, which is pretty amazing. So without giving away any trade secrets here, but you identified that opportunity. What can other founders learn from how you developed that? Was it all about just listening, or was it, listening to or having a good focus group? How did you kind of get to that point?
Depends on use case to use case. I can speak from the use case that we had. We were, because we are joint commission approved and accredited, we have to hold ourselves to a standard. we are able to hold ourselves to a standard to our clients that are also majority of our large hospital systems, also Joint Commission accredited as well. So we had an extra layer of audit built in. So we built a very customized rubric of assessment that our auditors were going through before actually like our claims would even go for the billing.
Mm-hmm.
The documentations were going through initially we started with 100%, then slowly we started randomizing that. And then we were able to assess all our therapists, their writing styles and things. But it was expensive. It was exhausting. So because we had an experience of doing so, we were able to actually like use AI models to rebuild these rubrics. And then instead of like randomly picking 10% to 20% of the notes and then evaluating them, now every single note, as soon as you hit submit button within the next 30 seconds, gets evaluated via this rubric model and given you with actually these are the areas your note is deficient in. When at the point of service, we call it POS, point of service itself, like you're presented, I haven't moved on and started thinking about next patient of mine. And you're presented with the feedback is like, in this patient, you haven't talked much about the patient pain because that's one of your most important goal. To justify this entire level of care, you must talk about the current level of patient's pain as well in today's documentation. You're like, perfect, quickly, done, and move on. So that actually like improves your quality of audit feedback looping. And that's what we saw over time, our quality of notes. And ultimately that results in dollars as well as better quality of documentation is able to support a better quality of revenue cycle.
Yeah, amazing. And as you're talking about that, I'm thinking, as you mentioned, it was painstaking with all that. I would imagine a lot of mapping and looking at specific protocols to get that done.
Absolutely. It's incredible how technology has grown over last 5 years, I want to say.
Yeah.
Before that, it was like a humans reading it through and making sure. Then it was like an OCRs where it's specific place or maybe like a resolution mapping. Now, these models are so amazing. You give an objective and then you provide the raw information. It is able to read through like a human would and then be able to hit right spot on. I'm super excited about what's happening today and what's going to happen in the next 5 years related to this.
Yeah, that's fantastic. And then as I mentioned in the introduction, your team's working with systems like the Providence Health System, right? Which on its own, I mean, that's a monster, right? With all the complexity going on just there. So, how did your team transition, like from the startup mode to an enterprise healthcare partnership? What kind of lessons did you learn from that?
Lesson number one, do not anticipate anything will be easy. Working with large health systems is a totally different style. When we come and I'm talking from the multiple, not only one health system, I'm talking about Ardent Healthcare System, I'm talking about Providence Healthcare System, I'm talking about University of Texas Healthcare System. We've worked with many large hospital systems and talking from that context. If you would anticipate something will be done in 3 months, probably that will be, if it is done, it will be in 9 months. So you want to actually like rethink about your timelines. And it's not that like the system is slow. It's because we have to ensure the patient's safety. We have to ensure the entire system's safety. Things take time. You have to go through multiple level of approvals. Any small change also will take a lot of time to be implemented. So, and health systems specifically, in healthcare in totality, and then when you go specific to healthcare systems, are known for being risk averse. So whenever you come up with like a new technology or new way of doing something very different and unique, the first thing you're always going to hear is no. And we heard that for years over years. And then I guess the persistence paid off towards the end of it. And we had to switch our ways of working as well. You have to prepare yourself, like accreditations like HIPAA, your Joint Commission, or SOC 2, or High Trust. The more processes like these, they don't pay off like directly. There's no ROI in one-to-one. But all of these things prepare yourselves to be able to present yourself as a credible company to work with large hospital systems like these.
Yeah, that's phenomenal. I'm thinking just, when you look at a large system like that, just the education component, right, of how do you use it? How do you get that put together? That's a daunting task on its own, right?
Oh yeah, I can tell you is like being a startup, like we assume a lot of things are just given, and you don't have to worry about it. But when you're in a very big system or a large corporation you work with, there's a procedure for every small thing.
Mhm.
I love it, and a lot of credit to my clients. Actually, like when we started out, we barely had documentation about anything. Today, you talk about any small use case and a variation of that, we definitely have a written SOP around it. So we're so well documented as a company, even being a tech or being a tech startup. Every single thing that we do operationally is fully documented. And we learned a lot working with these health systems that certain things you cannot actually push under the rug and say, we'll take care of it later, like how usually the startups would do. You have to take it front and center and then actually prioritize those things, even if there's no direct ROI with those things.
Yeah, and actually, you mentioned maintaining trust and credibility, right? How important that was, and just listening to your speaking and your process, I can see how you developed that. But on the other side, as a clinician and founder and an innovator, how do you balance that innovation speed, but yet maintain that trust? There seems like there's a fine line. Do you have any best practices for us there?
Um, I can speak from my own personal point of view. Means I have I'm blessed that I'm actually like a clinician by background. So I'm able to put myself in a user mindset and then see if I was the clinician, would I use this product? If I was the patient, would I use this product? And if the answer is no, there's no point moving forward from this. So that's very important. Like even if you're not a clinician by background, even if you're tech, at the end of the day what the user life cycle looks like.
Hmm.
If you're a builder of it, you're a founder, you need to ensure that either you talk to enough end users and understand how well are you solving their problem, or you're adding more burden to it. Sometimes just a small thing like which you feel may not be that important, but the end user experience actually changes significantly with you not doing or doing that specific point.
Yeah, that's very helpful. Thank you for that. And I also noted that, and you touched on a little bit about the Joint Commission, but I noted that your team made history, if I've got this right, as the first telehealth company to achieve a gold seal of approval from the Joint Commission, which amazing, and congratulations for that. And why don't you tell us a little bit about that story and why it's so important to you and your team?
Right. I think just a little while ago, we were talking about like how important it is to set yourself for success. And this was something like it's a voluntary, it's expensive. It takes a lot of effort and time and money to prepare yourself for an accreditation like that. But again, it is all about what you're willing to, how far you're willing to go to be able to prove that you're credible and you're able to sustain the demands of a large corporation or health systems. So let me tell you, like exactly how we came across Joint Commission and the process that we had to go through. It was super incredible because Joint Commission was just after the COVID coming out with this new program where, okay, telehealth companies are also coming out. They always did accreditation on a physical environment where they would walk in. And if you have ever worked in a health system or a hospital, the moment Joint Commission or state is there, everybody is like running around and then they're all like on their best behavior. And things are very different on that day when the survey is happening. So no one willingly or voluntarily would go in and say, come on over and then have actually a survey in our house. So, but we did because we thought like this will help us a lot more to overall show that like how well we are organized. But the point is, Joint Commission had never done a survey that was on a virtual company before this. So they built this brand new accreditation program. Kudos to them. They did an amazing job. And now this surveyor, morning 8 o'clock, joins on a Teams call. And we were given like, there'll be full day, but we'll see how this rolls. And if you know Joint Commission, they follow a tracer technology methodology. So in a tracer methodology, they will pick one patient and then they'll trace it from start to the end. And anything and everything that touched that patient, you have to present them those. Other than everything else that you have already, I think we had thousands of documents we uploaded that they had already evaluated. And then we got to the final survey thing. So 8 o'clock morning, my entire team and we all joined. And here's the surveyor. First of all, like he's like, there was so much of documentation. We were like, that's needed, right? So they were like, no, thank you so much. But then we started going into process by process, and every single thing, it was like 12 o'clock, 1 o'clock, 2 o'clock, and he's asking for information. We are providing it to him. He's asking for, and it was the longest call I have ever been on. It started 8 o'clock in the morning. We ended at 6 o'clock.
Oh my word.
In the evening, one single continuous call. Obviously, the surveyor took a little bit of a break here and there. But by the end of it, he was like, I can't find a thing to give you guys a tag on, but I'm going to give you one for sure. So he gave us a little bit of a point earlier in the day about, that was a very specific point he picked up on, like when a clinician says, I'm licensed in this state, how do you know he's licensed in this state? And we were like, we go to the website and we do a verification. It's like, what's the proof of that, what you did? We were like, that's when we approved them in our system. They were like, no, we need evidence. And we were like, okay. So he was like, I want a screenshot of the state website to be added in their file. We're like, okay. And he had mentioned this like flying by as a feedback at 11:30 in the morning. And we being a tech company, 5:30, he was like, I'm about to give you a tag on this, so we'll have to submit the plan of correction. We're like, no, hold on. We refreshed the page, showed him the whole workflow because our tech team already had built it by the time. So you're like, I have nothing to give you guys. So we passed it with the flying colors.
That's amazing. And what a great story too. And I'm sure you were very proud of your team for that one as well.
Oh, that was amazing. Actually, they were all on standby, did amazing.
Yeah. And I'm thinking also that the examiner must have learned a few things along the way in that call as well.
It was a learning process for both teams. And Joint Commission had already said that because this is our first ever survey that is fully virtual. So we'll have to also adapt accordingly as the things will come around. So yeah, and they sat into one of the virtual sessions actually. That was like, we don't even know how is it going to work. But like, so normally Joint Commission or any surveyor, they tend to walk into the real treatment, obviously with the permission from the patient and a clinician, and they walk in, they try to talk to the patient as well and things like that. So we had to create a very specific workflow on that day. And we didn't know which patient. We had hundreds of patients actually being treated simultaneously on that day. So we didn't know which patient he's going to pick up on from the roster, but then he did. And then we created a flow such a way that like, as if like you and I are right now talking, and he would hop in, we would introduce. And then he actually sat into a few of the sessions and then actually like went through the whole process.
Yeah.
That was super cool.
Yeah. What a great story and had to be a very interesting process. So, Ashok, it seems like this is a really exciting time for you and your team at TheraNow. What does the future hold, and where are you going from here?
I can talk about the industry as a whole, and then specifically about TheraNow. The future of rehab is going to be in a hybrid care, whether it's combining a clinic therapy with a virtual therapy and then a continuous remote monitoring, or a hybrid care of like one session omni-channel experience where a patient actually receives the first session in the home, and then for more hands-on care goes to the clinic, and then towards the end finishes that care online as well. So we are very well prepared for that, and we're building this omni-channel experience. We're partnering with health systems, those who already have this physical presence, and we are able to offer this experience to the patient. We're also investing in patient-centric healthcare that is heavily AI-powered clinical workflows. So where patients can actually also use your platform and then actually help themselves with the solutions that you provide. So we're making sure that we are ahead of the curve and making our workflows and our product ready for that change in the industry.
Oh, that's fantastic. It does sound like a very exciting time for you and your team. It'll be fun to watch. So, Ashok, first of all, I'd like to acknowledge and thank you for all the terrific insights that you brought to us today. If somebody wants to learn more about you or TheraNow, is there a website or in LinkedIn? How do we learn more?
Right. Oh, absolutely. Our website is amazing, TheraNow.com. It's with T, like therapy now, TheraNow.com. And I'm always available on LinkedIn as well. So please feel free to email me directly on ashok@TheraNow.com or connect me on LinkedIn. I'm looking forward to connect with a lot more of like-minded people. And anywhere, if I can personally help out or with anything in a healthcare product, I will be more than happy to.
Oh, that's fantastic. So once again, Ashok, we really appreciate your time and insights today in being our guru.
Thank you so much. Thanks for having me, Tom.
Thank you. Thank you for listening to MedTech Gurus. I am Sylvester Harris, your MC. If you want to learn more about Tom and his consulting services, you can go to www.pctmedical.com or email Tom at tom@pctmedical.com. Now, I can be reached at Sylvester Harris, that's SylvesterHarris 5048@gmail.com. And I'd be pleased to discuss any voiceover work that you may want for your company or broadcast. Hey, thanks so much for listening, and catch us on the next episode of MedTech Gurus.